Colostomy care in child. So in this video we will discuss about what is colostomy, definition of colostomy. There are some types of colostomy, and according to that, what is the complications, what is the indication, all those things we will discuss about in this video. So guys, please, from starting to end we need to watch for to know colostomy care and what is the requirements, why we have to done this procedure for those patients who are not able to evacuate fecal matters. So guys, please watch this video carefully. So let's start. So first we see definition. Colostomy is an opening called a stoma in a large intestine brought to the surface of the abdomen for the purpose of evacuation of bowel. So guys, colostomy is the opening. We all knows colostomy. So end of this week, what we have say, stomy. Stomy means opening, permanent opening into a part, like permanent opening of bowel, right? So colostomy is, it means there is an opening over what, over large intestine brought to the surface of the abdomen. Okay, for which purpose? For the purpose of evacuation of bowel, means evacuation of fecal matters. Okay, so that is the definition of colostomy. Next we will see there is a type of colostomy. So colostomy, there are different types of colostomy we will perform on those patients who are not able to evacuate their own fecal matters. So there is a congenital anomalies or there is any disease condition. Okay, so in that condition there are different types of colostomy we will perform. So in that colostomy according to duration, so there is a permanent and a temporary colostomy. Okay, so in permanent colostomy, what in permanent colostomy means not expected to be closed in the future. It means इसमें क्या ये देखना है कि जो डिसीज कंडीशन है या फिर कुछ कंजेनाइटल अनोमलीज भी है जो कि बर्थ ड्यूरिंग आफ्टर बर्थ या फिर बर्थ के साथ साथ भी वो एक कंजेनाइट जो एनोमलीज है वो जो बच्चों में आते हैं. So in that duration, what we have to see, what we have to perform, permanent colostomy. And in temporary colostomy, temporary means जो कि डिसीज कंडीशन है वो क्योर होने के बाद हम लोगों ने उस ओपनिंग को, जो स्टोमा को क्या किया, क्लोज किया. दैट इज द टेम्पररी कोलोस्टोमी. ओके, सो अकॉर्डिंग टू स्टोमा साइट असेंडिंग कोलोस्टोमी. सो वी ऑल knows there are three section in large intestine, right? There is a three sections like ascending, transverse and descending colon, right? So the according to site, according to stoma site means, जैसे कि अगर स्टोमा असेंडिंग कोलन को किया है तो उसे हम कहेंगे असेंडिंग कोलोस्टोमी. अगर उस ट्रांसफर कोलन को किया है तो दैट इज वी विल कॉल ऑन दैट टाइम दैट इज अ ट्रांसफर कोलोस्टोमी. सेम लाइक दैट डिसेंडिंग कोलोस्टोमी. अंडरस्टूड. नेक्स्ट, according to stoma number and type. So there is a single barrel, double barrel and loop colostomy. Single barrels means what? So there is that is also permanent colostomy. Okay, but there is one end only. In double barrel colostomy, so colostomy divided in the colon into the two ends. Okay, that from separate stoma. Understood? Then loop colostomy. In loop colostomy, in that loop of colon is pull out. Okay, throw a cut in your tummy. Okay, that is a loop colostomy. Next, indications. Indication means what and when we have to apply this colostomy procedures. Okay, so on which type of condition, on which type of patient we need to perform that colostomy procedure. So the first one is colostomy colon cancer. Okay, cancer, maybe it is cancerous cells, means it is starting from benign cells. Okay, so cancerous cells means that is only and only malignant cells. Okay, so colon, there is a malignant tumors or malignant tumor cells form in colons, that is colon cancer. Okay, so in colon cancer condition, in Hirschsprung diseases, there is a congenital, that is a congenital anomalies. In Hirschsprung diseases, we also perform colostomy. Ulcerative colitis, itis means inflammation. There is infection and inflammation in the colon area. There is ulcerative colitis. Polyps in intestine, polyps in intestine means, we know all those things. There is a polyps in intestine, so there is obstructions occurs in what, in intestine. Okay, so in that time we need to perform colostomy procedure. Understood? Next, so how we can perform, so what type of articles we need during colostomy care. So we all knows about colostomy. Now we have to know about articles requirement in procedure of colostomy care. Okay, a clean tray containing. So, in clean tray containing, what we have to know about mashing tools. So first of all procedures, we need to know about what article requirements, which type of articles we need to know about, which type of requirements, which type of articles we need. That is the very important thing in procedure. Okay, so first we need to gather all articles, required articles, right side of the patient. Okay, so first what we have to need. So first we need Macintosh with draw sheets. Okay, for what, जो कि हम लोगों को क्या करना पड़ता है, पेशेंट के बिलो, मतलब बेड के सबसे पहले वाला जो हिस्सा होता है, अब ऊपर वाला हिस्सा, उसमें क्या सबसे पहले मैकिंटोश को शीट को ड्रॉ करनी पड़ती है, ताकि हम जो प्रोसीजर्स फॉलो कर रहे हैं, जो प्रोसीजर्स हम लोग कर रहे हैं, इसके कारण जो हमारा बेड है वो पूरा का पूरा डर्टी ना हो. फाइन. नेक्स्ट वन, व्हाट वी नीड, kidney tray for what, for disposal, waste disposal. Okay, we need also paper bags. Third one is pair of clean gloves. So we need also clean gloves for care. Okay, colostomy bag for what? Colostomy bag for, obviously it's for collection of waste. NS or basin with warm tap water. So what is warm tap water? It is not that much cool, not that much hot. Okay, gauze pieces for what? For cleaning. Gauze pads for what? For tapping or for cleaning all surface area. Okay, tissue paper also, clean barrier, skin barrier. So we need to know about condition of the skin. Stoma measuring guide for to know the size of the stoma. Okay, pen or pencil and scissor also. So we need to mark the stoma side, and for measuring and for purpose of know the stoma, there is infection, there is inflammation. If there is infection, there is inflammation, so the stoma side will be enlarged or inflamed. So in that condition we need to know, we need to mark with the help of pen or with the help of pencil. Okay, so after that what we need bedpan also. So during that procedure, that colostomy care procedure, we need to remove this waste product like fecal matter from this before attach colostomy bag. So we need also bedpan for that purpose. Okay, next, colostomy bag. See guys, this is colostomy bag. So first of all, we know colostomy bag is not so much uh, so much what, cheap. It is actually very costly. From, it is the range of this colostomy bag, this price is, I think it's from 600 or 700 up to the 1500. So in this bag, we what the use, the duration of this use this bag is, I think it's 1 to 3 days. Like in these 3 days we need to discard this bag. So use very carefully. Okay, next. So ये जो हम लोगों को जो अभी दिख रहा है, that is a opening. So we will see there is a stoma, like permanent stoma, permanent opening in the colon side, right? So that is a colostomy. There is a stomy and there वो जो हम लोग ये देख रहे हैं बैग देख रहे हैं, that is colostomy bag. Okay, next, colostomy care step by step. So the most important motto, ये जो हम वीडियो देख रहे हैं इसका सबसे इम्पोर्टेंट जो पर्पस है वो है कोलोस्टोमी केयर किस तरह से स्टेप बाय स्टेप फॉलो करना है. ओके, सबसे पहले मैंने जैसे बताया है, गैदर ऑल इक्विपमेंट्स फ्रॉम व्हाट, from your units, and collect it and gather it and kept it from kept it from for where, right side of the patient. Okay, second is encourage client to look at the stoma. encourage करना है client को, patient को, कि वो जो stoma है, वो जो opening है, वो उसको देखने के लिए. Fine. Explain the procedure to the patient. If there is a child, so no need to explain because चाइल्ड कुछ समझ नहीं सकता बट उसके पेरेंट्स जो है वो समझ सकते हैं. सो इफ द patient is not appropriate for that condition, for encouragement or for appreciate for encouragement or for understand, he is not understand, so on that time we need to explain all the procedures to the patient's relatives only. Okay, so explain the procedure to the patient. If patient is adult, so we need to explain her or him. Okay, if the patient is child, so explain to her or his father or mother. Okay, provide privacy. पेशेंट को प्राइवेसी देना, इट्स वेरी वेरी इंपॉर्टेंट थिंग इन दैट प्रोसीजर. ओके, कोई प्रोसीजर कोई भी हो, if there is a necessity, if there is a necessity of the privacy, so we need to give privacy to that patient. Okay, fifth one is perform hand hygiene to wear and wear gloves. ग्लोव्स वेयर करना है फॉर व्हाट, टू प्रिवेंट इन्फेक्शन, राइट. we need to perform hand hygiene also for what, for to prevent infection, for to prevent cross infection. Okay, next, spread macintosh and draw sheet. Okay, टू प्रोटेक्ट मैकिनटॉश स्प्रेड क्यों करना है, मैंने पहले ही बताया है. मैकिनटॉश स्प्रेड इसीलिए करना है फॉर टू प्रोटेक्ट लिनेन, जिससे हमारे जो लिनेन है लाइक बेडशीट्स एंड जो भी ब्लैंकेट्स वगैरह जो है वो डर्टी ना हो, राइट. रिमूव यूज पाउच एंड स्किन बैरियर जेंटली बाय पुशिंग द स्किन अवे फ्रॉम द बैरियर. ओके, for what, to reduce trauma, jerking irritates skin and can cause tear. So tear होने का भी एक खतरा रहता है in that condition, so we need to use pouch. Remove this pouch and skin barrier also. Okay, remove clamp. जो हम लोगों ने क्लैंप यूज किए है उसमें वो जो क्लैंप है वो भी हमको क्या करना है, रिमूव करना है. एंड एम्प्टी दी कंटेन इनटू द बेड पैन. जो बैग है उसका जो भी कुछ है वेस्ट मटेरियल, जो फिकल मैटर है, उसको क्या करना है, एम्प्टी करना है, किसमें, बेड पैन में. ओके फाइन. देन rinse the pouch with tap water और NS. वो जो पाउच है उसको क्या करना है, क्लीन करना है फॉर tap water, for to reduce, to minimize the growth of microorganisms. Okay, discard the disposable pouch in paper bag. If we use up to the 3 days, so in that time we need to dispose, we need to discard this pouch in the paper bag. Okay, for what, for to reduce, for to minimize odor or growth of the microorganisms. Okay, next, so observe stoma for color, for swelling, trauma and healing. Stoma should be moist and pink. Okay, so why we should observe all those things, color, swelling, trauma, healing, why we should you observe, for for what, for find out complications, right, for find out complications we need to observe all those things. Okay, cover the stoma with gauze pieces. Okay, why we need to cover the stoma with gauze pieces, to prevent the fecal matter from contacting with the skin. अगर वो स्किन के कांटेक्ट में आया फीकल मैटर, तो क्या होगा उससे, उसके उससे क्या होगा, इन्फेक्शन बढ़ने का चांसेस जरा ज्यादा होगा. सो इन दैट टाइम व्हाट वी हैव टू डू, cover the stoma with the gauze pieces. Okay, clean peristomal region gently with warm tap water using gauze pads. Don't scrub the skin. Dry by patting the skin also. Okay, remove gauze and clean stoma with the gauze pieces. Okay, for what? Stoma surface is highly vascular, right? So skin barrier does not adhere to wet skin. Okay, so measure the stoma using measuring guides like measuring tape also. Okay, that is also important. नेक्स्ट, ट्रेस सेम सर्कल. जो हमने सर्कल बनाया है स्टोमा के सराउंडिंग में, तो उसको क्या करना है, स्ट्रेस करना है. द स्किन बैरियर यूजिंग सीजर्स कट द ओपनिंग 116 and 1/8 inch larger than stoma before removing the wrapper over adhesive part. सो जो हमारी कोलेस्ट्रोमी बैग होती है, उसका जो सर्कल होता है, ओपनिंग वाला सर्कल, उसे 116 to 1/8 इंच लार्जर देन स्टोमा साइड्स में ऐसे ही कट करना है. ओके, बिफोर बिफोर रैपर जो होता है इसके ऊपर का, वो उसको निकालने के, एडेसिव पार्ट को निकालने के पहले उसको कट करना होता है. ओके, पुट स्किन बैरियर एंड पाउच ओवर द स्टोमा. जो स्टोमा है उसके ऊपर क्या करना है, उसको पुट करना है. एंड जेंटली प्रेस ऑन द स्किन फॉर 1 to 2 minutes. Why we have to press that skin? For attachment of that bag. Okay, so ensure accuracy is determine correct pouch size needed. Okay, that is also important. And to prevent irritations to the skin. Okay, there is some irritation, obviously there is a stoma, it means there is some irritations. Okay, so we need to prevent that irritation. Use the pouch if it is drainable using a clamp or clip also. Remove gloves and wash your hands carefully. Make the patient comfortable. That is also important. After that all procedures, we need to make the patient comfortable. Okay, clean the area and replace all articles. That is also important for all nurses. Okay guys, then documentation. What type of documentation we have to perform in that procedure? So first one is date and time. After every procedure we need to mention date and time also, date of this procedure and time also. Then amount, if what how much how much amount of fecal matters uh, is evacuated, that is also important, and we need to document it, that thing. Okay, then color of fecal matter. Okay, consistency of fecal matter, then sign of any infection. If there is a sign of any infection, like there is, if we see any inflammation in that stoma site, so we need to document it, all those things. Okay, so guys, I hope you understand all those things. So that is colostomy care we need to perform easily. If you like my video, so please like, share and subscribe, and please subscribe my channel for more interesting videos. Thank you guys.